Good afternoon. I'm here to provide an update on Alberta's response to the COVID pandemic, but before I do so, I just wanted to note off the top that today we saw that Alberta has now lost over 2,000 lives throughout the pandemic over the past year. And so to all of the loved ones and family of the 2,000 people whose lives have been lost over this past year, I just want to begin by extending my heartfelt condolences, and I know that is shared by all Albertans. Today, I am here to announce new measures that will help to stop the spike of COVID-19 cases in our province. This is not an easy announcement to make, or a step that we are in any way taking lightly. Last week, I came to Albertans with a plea that they follow the health measures in place to stop the spread over the long weekend and in the weeks to come. And I know that many Albertans have risen to that call, and for that I thank them sincerely. Having said that, cases have continued to rise sharply over the past week, averaging almost 1,000 new cases per day over the long weekend. The surge in variants of concern that I talked about last week has picked up its pace. This slide shows that variant cases went from about 100 a day only 3 weeks ago to 676 today. And so now variants are pretty consistently over half of our new cases, over 40% of our total active cases. In the race between variants and the virus, the variants are winning. We often talk about why these variants are so dangerous, but let me provide one example. Pardon me. Spring allergies. Let me provide one example of how quickly variant cases can spread. This chart shows what happened when a returning traveler from British Columbia came back to Alberta on March the 6th with the P1, so-called Brazilian variant. This person spread infection to 5 others in various meetings that they held. These first-generation cases then went on to spread to others through household encounters and social visits, and in one subsequent third-generation case, spread during a hairdresser's appointment. And on it went. From one case, we now have seen 35 cases result, including 1 death and 2 people admitted to ICU. Similar stories are playing out across the province. These variants are a real enemy of public health and of lives. And tired though we may be, we cannot stop now. We must defeat these variants. There are now 10,809 active cases of COVID-19 in Alberta, a 27% jump in the last week alone. As this short-term projection shows, and this is, by the way, this is not based on modeling with a lot of assumptions. This is based on what we know right now, because people who right now are contracting COVID today, about 5% or more of them will show up in hospitals 2 weeks from now. So these are short-term projections, and they show that we are on track to hit a weekly average of 2,000 daily cases by the end of this month, based only on transmission that has occurred to date. And we can expect to see up to 1,000 COVID patients in hospital by the end of this month. Even at the height of the second of the wave back in December, we topped out at just under 1,900 cases a day. Now we are well on our way, I should say, to exceeding that. To be blunt, this wave is here. These trends would threaten the maximum capacity of our healthcare system by next month, right when we're reaching critical mass of vaccination. Now, let me just pause there to say that we've worked hard with Alberta Health Services to expand the capacity of our healthcare system to cope with COVID. And we believe that we could accommodate upwards of 2,300 or 2,400 COVID patients at a terrible cost, namely the cancellation of all non-urgent surgeries and many other medical procedures. And we believe we could accommodate a little over 600 in ICU units. But we believe that based on the current trajectory, if we don't slow down this curve, that we are set to hit the maximum capacity of our system in mid-May. A great tragedy, given that it's right around mid-May that we'll begin to achieve effective coverage of vaccines. So most importantly, these trends would challenge the health of thousands of Albertans and lead to many, many more preventable deaths just at the end of this thing. Over the winter months, our province bent that curve created by the fall wave that started around Thanksgiving tables across the province. Because of the measures we put in place and have kept in place, we managed to contain that and bring those numbers down. Thank you again to Albertans for your diligence in doing so. But as Premier, my job is to make the tough choices and to protect the lives and livelihoods of Albertans. The only responsible choice to save lives and protect our healthcare system is to take immediate action. And that is why this morning the COVID Cabinet Committee decided that we must make strong steps to slow the spike and to start bending down the curve one last time. Alberta will be returning to effectively step one of our four-step path forward plan. These measures are designed to buy us time to get enough Albertans vaccinated so we can finally get through this thing. Effective tonight at midnight, this will mean lower capacity limits for retail settings, including shopping malls. For adult fitness, one-on-one training with a trainer or instructor is still permitted. Unsupervised individual fitness and group fitness activities will not be allowed. For children's sport and performance lessons, practices and conditioning may continue with restrictions. Performance activities, which include dancing, singing, acting, and playing a musical instrument, will not be permitted during this period, and libraries will be closed until further notice. Finally, starting Friday at noon, indoor dining at restaurants will not be allowed. Takeout, curbside, pickup, and delivery services will remain unaffected, and outdoor patios will be allowed to stay open for bars and restaurants. All other health measures remain in place at this time, and that is important to underscore because we know that we see a growing percentage of Albertans who just given up on this and are not complying. We can only do this together to prevent a prolonged situation, a huge wave that causes massive cancellations of surgeries in our hospitals and hundreds of preventable deaths. Avoiding that outcome depends on following the public health measures that are already in place. Health officials will closely monitor the spread of COVID-19 to determine if additional actions are required. Alberta's government will provide a package of additional financial assistance for businesses affected by today's measures, and will make an announcement on that in the very near future. For example, we acknowledge that restaurants may lose some spoilable inventory, that others may have expenses to expand patio operations. We hope to be there as quickly as possible to assist them in dealing with those costs. Last Thursday, I said that if we just stick to our guns for a few more weeks, we'll head into what I truly believe will be the best summer in Alberta's history. If we just get through the next few weeks, that remains true. Now, I know some Albertans will disagree with the government's decision today, and that includes undoubtedly some people in my own caucus and party. I fully expect to hear some of those opinions publicly in the coming days, and I welcome that. I've always welcomed a wide-ranging debate on how best to rise to the challenge of this pandemic. I just ask that the debate be informed by facts. Alberta is a diverse province, and that includes diversity of opinion. It's not surprising that Albertans' elected officials also have diverse views on how best to handle the pandemic. And I also know that in our society, there has been a real polarization of views on how best to deal with the challenge of this pandemic. On the one hand, we have some people who want what are called hard lockdowns and have wanted those on a long-term basis. Others who believe that the threat is massively exaggerated and we should have few or no restrictions. But Alberta's approach has been to find a sensible, safe, middle ground, a common ground that you can unite most Albertans. Our goal from day one has been to control viral spread, to prevent an overwhelming of our healthcare system, to avoid large-scale preventable deaths while minimizing the damaging effect of public health restrictions on the broader social and economic health of our society. That has been our goal. And by that standard, I think we have done well. But now we're in the last part of this. Few decisions in this pandemic are easy decisions. Decisions can and do often have adverse effects. There's no sugarcoating that. But the government cannot ignore the science, we cannot dismiss the medical advice, and we cannot ignore the numbers. As Premier, I cannot in good conscience ignore the evidence and opt for a policy that could result in hundreds of preventable deaths, of huge impact to our hospitals being flooded, and other critical health procedures being put at risk. I cannot and will not do that. Nobody wants to keep restrictions any longer than is absolutely necessary. I hope that's one thing, though, that we can all agree on. And as such, I can also announce that a committee of government MLAs will work with Minister Shandro and Alberta health officials to plot a path back to normalcy as soon as safely possible. This path will be critical as the number of immunized Albertans continues to rise by the day, especially amongst those most susceptible to serious health outcomes, such as hospitalization and fatality. We expect this committee to provide their recommendations by the end of this month. Vaccines, of course, remain our best hope, and that's also why I'm announcing today big changes to speed up our vaccine rollout. We have the best program in Canada. Nearly 750,000 doses, have been administered. More doses means that we can finally look forward to in the coming months. Every day, more and more people gain immunity through infection from the vaccines. In the coming weeks, we'll be able to say that almost a quarter of Albertans have achieved immunity, either by the vaccine or natural immunity through infection. By the end of May, that will be almost half of our population. And by the end of June, it'll be almost 2/3 with some level of protection. And by mid-September, we project, if Albertans take us up on the vaccines, as I hope they will, that almost 3/4 of Albertans will have a good degree of immunity. This is the end of the tunnel. It is our path to recovery. It is our path to freedom. Right now, we're in a transition period, fighting to keep control of the virus just a little while longer until it is vanquished by vaccines. As more people become immune, we will be able to get back to normal. When about half of us have immunity, we'll be raising capacity limits. We'll be able to gather together in larger groups. Some restrictions will remain, but not like now. Once 2/3 of us have immunity, it'll start to feel like normal. There will be no formal restrictions. Stampede and other festivals will be possible. Masks and distancing will be part of our lives, but only encouraged. And then once 3/4 of us are immune, we'll be fully back to normal without masking, without isolation. And that's just the start. We'll share more details on the path to recovery later this month. This is all right ahead of us, and we are so close. It's possible because we are finally seeing the shipments that should have come weeks or months ago. In the past week, Alberta's received almost 400,000 doses of vaccine, which is roughly 35% of the total received since the start of the pandemic. With vaccine supply increasing, we're ramping up the rollout to a whole new level. In the race between the variants and the vaccines, the variants are most definitely winning now. But these 3 steps, Alberta's new vaccine ramp-up strategy, will help us make up some lost ground. Here are the 3 steps. First, starting tomorrow, we'll open bookings for all individuals in the Phase 2B category. That means every Albertan over the age of 16 with an underlying health condition can book an appointment. Currently, about 150,000 Albertans are able to get vaccinated under Phase 2B, with those born in or before 1973 being eligible. But by immediately expanding Phase 2B, as we are doing, to include everyone born between 1974 and the year 2005, well, 500,000 more Albertans will become eligible for vaccines overnight. That's a major step. Also, effective immediately, Albertans aged 55 to 64 who do not have a chronic health condition can also make an appointment to get the AstraZeneca vaccine. The AstraZeneca vaccine is safe and effective at reducing severe illness from COVID-19. We received a large shipment of about 175,000 doses on Thursday. We were actually expecting it yesterday. It came early. We're getting it out to pharmacies right now. The rare blood clots reported in Europe have not been reported anywhere in Canada to date. Second, we will launch a series of new rapid flow-through clinics across the province for faster vaccination starting this week. Rapid flow clinics are being set up or have been set up in Grand Prairie, Fort McMurray, Edmonton, Red Deer, Calgary, Lethbridge, and Medicine Hat. Government and Alberta Health Services are working with those municipalities to secure large facilities that can safely accommodate large volumes of people to be immunized in a short period of time. And finally, participating pharmacies will soon be able to allow walk-in bookings for the vaccine rather than by appointment only. We hope that will further accelerate the vaccine program. Additional information will be shared when this becomes available next week after we've worked out the details with the pharmacies. These are three big steps forward for Alberta's vaccination rollout, and there is no question that vaccination is our ticket out of this. The sharp decline in deaths amongst elderly Albertans proves just that. Widespread vaccination is the finish line we all need to head for. We are well on our way and well positioned to offer every adult Albertan who wants a vaccine their first dose by the end of June if the federal government provides the supply that we require and that they've promised. Until then, our collective efforts will determine how fast this latest and last wave crests. We're getting carried up by this wave against our will, but we determine how we land. So please make the right choices to buy us time to vaccinate more Albertans. Before I close, I just want to say I know that this has been a time of incredible stress and anxiety for so many Albertans. Announcements like the one today disrupt many people's lives and their livelihoods. The spike that we are living through is going to send hundreds of Albertans to hospital and affect many families in a dramatic way. Folks, I know we're all so tired of this. Everyone has what we call COVID fatigue. Everyone is feeling it in their families. Everyone is feeling some level of mental or emotional stress, and just so much are so tired of the uncertainty of the changes in policy of the various waves of the pandemic. But please know that we are getting to the end of it. We've just got to finish strong. We have to pull together. I am concerned about the real polarization in the debate in this province and that we've seen around the world. How about we find unity in our shared commitment to each other, to keep each other safe, to emerge from this stronger than ever. I know that we can do it. Thank you, and with that, I'll turn it over to Minister Shandro, who will provide some more details, and then Dr. Hinshaw will provide today's update. Yeah, of course.
Well, thank you, Premier, and good afternoon, everyone. I know that today's announcement that we are moving back to step one is disappointing to many, that it's frustrating to many. And it may seem like the progress that we've made to date together is forgotten, or that our efforts so far have been futile. But let me be clear, they were not. And the reality is that we are in a race to get people vaccinated. And while the race is almost over, we need to do more to protect our healthcare system until we cross the finish line. We've always said that we'll keep an eye on our metrics, both the leading metrics and the lagging ones, and take whatever action is necessary. And that's why we're taking this step today. I'll now walk you through some of the major changes, but it's a lot of information and more details are posted online. The first change is that effective Friday at noon, restaurants, pubs, bars, lounges, and cafes will no longer be able to offer indoor, in-person service. Takeout, curbside pickup, and delivery services can continue. Recognizing that we are seeing better weather and the risk of exposure is lower outdoors, outdoor patios can remain open. For those patios, all the other previous restrictions must be followed, and that includes a maximum of 6 people per table. And most important of all, folks should only be going out with members of their immediate household or their designated 2 close contacts if they live alone. We're giving business owners time to prepare for the change and to do things like staff planning, using up inventory, and notifying their customers. And this is something that they've asked for, and we're committed to working with them through this change. All the other changes will take effect at midnight tonight. And that includes, first, we are updating the rules on indoor fitness. So starting tomorrow, the only indoor fitness activities permitted are one-on-one training, either with one individual or with one household. This includes sessions with a personal trainer, figure skating training on ice, one-on-one lessons for activities like dance or tennis. And these sessions also have to be scheduled or made by an appointment. No drop-in or unsupervised individual fitness activities are permitted. No indoor group activities are allowed. Outdoor physical activity remains a great option for folks, especially with the nice spring weather that we're now experiencing here in Alberta. There can be a maximum of 10 people, provided that physical distancing is maintained at all times between different households. Retail services and shopping malls must reduce their customer capacity, so this will drop from 25 to 15% of their fire code maximum occupancy. As always, we encourage the use of curbside pickup as well as delivery services wherever possible to minimize in-person interactions. Performance activities of any kind for adults are no longer permitted, and that includes dancing, singing, acting, playing musical instruments, and any theatrical performances or rehearsals. The rules for children's sports and recreation activities remain largely the same as they are right now. The one change is that playing surfaces, like arenas, fields, courts, or pools, can no longer be occupied by more than one youth group at a given time. Hotels may remain open, but their spas, their pools, and in-person dining must close. Only room service is permitted. Libraries, as Premier said, must close until further notice. However, they can continue to provide online services. There are several types of activities and venues that will see no changes in their restrictions. For example, health services like physiotherapy and acupuncture, those can continue to operate, as well as social or protective services, shelters for vulnerable people, childcare, and not-for-profit community kitchens. There are no changes to the restrictions for places of worship. In-person attendance at these venues remains limited at 15% of their fire code occupancy, with mandatory masking and distancing between different households. We continue to strongly encourage the use of online services. There are also no changes to personal and wellness services like hair salons, nail salons, massage, tattoos, and piercings. These businesses can continue to operate by appointment only and provide one-on-one services. And I know that one of the most challenging restrictions has been the ban on indoor social gatherings. This has been, and it continues to be, a critical measure because we know that these settings are a major source of viral transmission. I'm glad to say that outdoor social gatherings of up to 10 people can continue as long as participants remain physically distanced. And I urge Albertans to gather outdoors if they want to see friends, if they want to see family. It's a much lower risk option and it's within the rules. I firmly believe that these mandatory health measures will only be needed for a short while as we continue to vaccinate more Albertans as fast as we receive the doses from Ottawa. And though it may not feel like it, this is only a temporary setback on our return to more normal life. We just need to stick at it a little while longer, as Premier said. So thank you, and I'll now invite Dr. Hinshaw to provide today's COVID-19 update. Thank you.
Thank you, Minister, and good afternoon, everyone. Before providing today's update, I want to address concern about an outbreak of the P1 variant that was identified over the weekend. I know there has been concern that more information was not shared with Albertans when we first provided information about this outbreak on Twitter over the weekend. I want to be clear that while we are concerned about this outbreak, we should not lose sight of the fact that these P1 cases are a tiny fraction of the thousands of cases reported over the weekend. We are still learning about the characteristics that the P1 variant has, but we know for sure that all COVID-19 cases have the potential to cause severe illness and even death. It is not clear yet if P1 causes more severe outcomes than other strains, but we do know that it, like the B117 variant, is more infectious. We need to make sure we are looking at this big picture when considering all of the variants that we are seeing in the province and taking actions every day to prevent spread of all strains of COVID-19. Turning to today's update, we have now administered more than 734,000 doses of vaccine in the province. Over the last 24 hours, we have identified 931 new cases of COVID-19 and completed about 9,100 tests. This puts our positivity rate at about 10.2%. Over the last 24 hours, we have identified 676 new variants of concern. There are currently outbreaks or alerts in 413 schools, which is 17% of all the schools in the province. There are 328 people in hospital for COVID-19 treatment, including 76 admitted to the ICU. Sadly, 3 additional deaths were reported to Alberta Health in the last 24 hours. These people's lives mattered, and they will be missed. My thoughts are with anyone who has lost a loved one during the COVID-19 pandemic, whether to the virus or any other cause. I also want to let you know that due to an increase in COVID-19 cases in the Bow Valley area, including Banff, Lake Louise, and Canmore, including 3 variant cases, AHS is working closely with the operators of Lake Louise and Sunshine Village to conduct on-site and community testing of all employees and contractors. At this stage of the investigation, there is no identified single event or cause for this increase in cases. My local colleagues are working hard to prevent future spread and support everyone involved. At this time, we are not recommending precautionary COVID-19 testing for anyone who has visited or skied in the Banff-Canmore area recently. However, if you are symptomatic, as we always advise, stay home, isolate, and arrange for testing. As the Premier noted, cases continued to rise over the weekend. Our active cases have now risen by 27% during the last week alone. Today, about 43% of all active cases are variants of concern, and that figure is rising sharply. I know that many people will be disappointed that we are once again forced to implement aggressive public health measures. I know that bringing in new restrictions can be frustrating when it feels like we are so close to the end. It's natural to be frustrated and to be sick and tired of this pandemic. We all wish these measures were not necessary. But we are at a critical juncture. In the last week alone, we have diagnosed more than 6,700 cases of COVID-19. Our hospitalizations, ICU admissions, and positivity rate have all increased sharply. If we do not take action, fatalities will also rise in the coming weeks. As I mentioned last week, variants of concern present a new challenge, one that we cannot ignore. These variants are not only more contagious, but also, in the case of B117, more likely to cause severe illness. This means that as cases rise, an even higher percentage of younger cases are likely to need hospital care. The good news is that we have shown time and time again that these measures work. By taking widespread steps to limit in-person interactions across society, we stop the spread. It is our best path to reducing spread in the short term, while vaccines offer the long-term hope of resuming something closer to normal life in the months ahead. The challenge now is to dig in and bend down the curve one last time. If we can stop this sharp increase we are seeing and break the chains of transmission, as well as continuing to get vaccinated when we are eligible, then we will save lives and get back to normal as quickly as possible. If we do not keep cases low now, then it will take longer for us to see the benefits of the vaccine, and we will be dealing with this pandemic into the summer months, which none of us want to see. This has been a challenging pandemic, and we have one more hill to climb. I ask all Albertans to do their part and abide by the restrictions in place to avoid another surge of cases that will take months to get back under control. As I said more than a year ago, I believe in Albertans and the power of our collective actions. Together we can slow the spread once again and keep cases low for just a few months more. Thank you, and we're happy to take questions.
All right, folks, just before we move over to the Q&A here, just a reminder to folks on the line to please limit yourself to either 2 questions off the top or 1 question and 1 follow-up. And with that, operator, can we please put through the first caller?
Thank you. The first question is David Staples, Edmonton Journal.
Hi, thanks for taking my call. Premier Kenney, you mentioned a little bit about the end game with vaccination. I wonder if you could expand on that. We saw in Texas that once they got to 15% single-dose vaccination, they opened up considerably. What are our markers for opening up considerably, and how quickly is that going to come about in terms of the time frame?
Thanks very much, David. So just bear with me. I've followed that situation in Texas and other jurisdictions very closely. Couple of differences. First of all, in Texas, they had a much higher level of natural infection and immunity generated from that, obviously, because, Texas, I believe they had at least 300% more deaths per capita than we've had in Alberta. So I wouldn't regard that as any kind of a COVID policy model. But with that widespread infection also meant a higher level of natural immunity. Secondly, the U.S. is about 3 times faster than we are in terms of vaccinating the population. That includes Texas. And so I laid out here in my presentation a path forward which includes gradual but significant steps towards relaxation of measures that are pegged on our population immunity. And so I'm just looking for the correct slide for you, David. So, and we'd be happy to send this to you and other journalists. But essentially, we project that by around the end of May, about nearly half of Albertans will have achieved some level of protection. So remember that after the first dose, people are estimated to have about 75% protection. They need that second dose to get closer to fuller protection. And we believe once we reach that point that we can move to higher capacity limits, to have larger gatherings that are allowed, and to move forward substantially, as I say, towards the end of May. And in the end of June, around 64% of Albertans will have some level of protection either from natural immunity or vaccination, we estimate. And potentially we could look forward to lifting almost all restrictions. Fairs and festivals would be able to proceed. Masking and distancing would be encouraged but not mandated. And so that's the kind of path forward that we foresee as we move up in terms of protection. So, sorry, if you have a follow-up, David?
Yeah, we're seeing libertarian Albertans openly cheering on civil disobedience. You know, church pastors yelling and screaming at police officers trying to come in to shut them down. How do you think, what's the proper response from the government, and what's your message to those Albertans who are now kind of openly cheering on this kind of civil disobedience?
Well, my message is that their actions have real consequences, that their actions can cost lives, that this is not made up. As of today, we've lost over 2,000 people to this disease. The variants are real. They are far more contagious. They are more damaging. They attack younger people, and they can be more lethal. That's not my opinion. That is the clear science that has emerged from countries that have been hit by the variants much earlier than Canada or Alberta. So my message to them would be, I understand profoundly their frustration, the impairment of rights and freedoms, of the ability of some people to make a living. They are right to raise those concerns. I have never dismissed, in fact, I have often echoed the concerns of freedom-loving Albertans. As I've said before, I'm glad to live in a province where there are a lot of people who jealously guard and protect their freedoms and who are skeptical about government policies that impair those freedoms. So I embrace a diversity of views on this. But unfortunately, we do see some people who don't just make those arguments about how to balance the public health imperative with rights and freedoms. In some cases, we see people counseling reckless actions that could accelerate viral spread, that could overwhelm the healthcare system, force the cancellation of surgeries, and create significant numbers of preventable deaths. I'll share with you, David, it's no secret I've been wrestling with finding this balance. There's no easy or simple formula to do so. We have to approve the virtue of prudence, the practical application of kind of moral wisdom to these issues as they arise. But ultimately, what causes me to support measures like the ones we're announcing today is my belief in the sanctity of human life, and particularly a moral obligation that we bear as a society, that we all bear for our neighbors, to protect the most vulnerable. And I believe that is hopefully a life ethic that we share broadly in our society. I know many of the people to whom you are referring are people of faith. And I would appeal to them to reflect on that life ethic, which is shared by every major faith community.
All right. Thanks, David. Operator, can you please put through the next caller?
Carrie Tate, Globe and Mail.
Hi, Premier. Thanks for taking my question. I'm a little confused right now on the reopening plan. You talked about a committee, and you talked about certain percentages of immunity. Does this mean that the previous plan that looked at hospitalization numbers is no longer?
Well, it means that we're going to look at the impact of vaccinations. Obviously, they're a total game changer. In the winter, as we emerged from the fall spike, we wanted to make sure that we didn't risk additional stress on the healthcare system, which is why we tied stepped relaxation of public health measures to a reduction in hospitalizations. Now that has turned around. We always said that if we got into a spike with exponential growth, that we might reluctantly have to come back with restrictions. That's where we're at today. But now as we look between the beginning of April and the end of June, what we see is the vaccines becoming the dominant factor here. So we would be foolhardy only to look at hospitalizations as the principal criteria in reopening once we get past this spring wave. I think it's just sensible that we would tie it to community immunity as a key factor. But we'll take on board advice on that, and that committee will also be looking at whether we can apply that in a regional basis for more accelerated relaxation of restrictions, for example, in certain areas with very low numbers.
Do you have a follow-up, Carrie?
I do, and thanks for taking up follow-up questions. This is to both the Premier and Dr. Hinshaw. You've both addressed how for communities there's been a skepticism over COVID that it's sort of more of an urban problem. You both addressed that directly. I'm wondering why, given that, there was not more disclosure on the P1 cases in Edson, Hinton, and Drayton Valley, even with respect to patient confidentiality.
Well, first of all, when we disclose information to the public, it's in the interest of transparency, balancing that against the critical importance of protecting patient confidentiality. And as I mentioned, it's really important to remember that the P1 variant like the B117 variant, is more infectious. However, it's also important to remember that we have seen spread of all different kinds of COVID-19, B117. More recently, we've had these P1 introductions. For a year now, we've had rural areas that have been hit by the previously common COVID-19. And so introduction of COVID-19 into a rural area is not new. It's something that has happened frequently in the past. And when we shared the information about the P1 outbreak on the weekend, it was in the interests of, again, providing information to Albertans in general that that particular variant had now been identified in the province. But as we always do, we work closely with those individuals who have been deemed close contacts, those who are cases, so they have the information they need. And I would encourage all Albertans, wherever they live in the province, to follow the measures every single day, because what we can learn from this outbreak is that if we waited until there was a notification of a variant in a particular community to follow measures, then we see spread because, again, once it's happened, it's too late to prevent it. So the decision to disclose in general was, again, out of the public interest to be transparent about the fact that P1 was here. But we do not routinely disclose specific locations unless there is general public risk, which in this case, we did not deem there to be in those specific locations because there was specific follow-up with all of those who had been in close contact with individuals who were infectious.
I just wanted to, thanks, Doctor, for that. I wanted to add something in my response to David Staples on his first question, which I forgot to. He asked about Texas, and that's an interesting case study, if you will. But David, I'm constantly scouring kind of jurisdictional comparators to see how COVID is performing and how governments are responding in different contexts. And you could also point to, for example, the United Kingdom, Israel, and now Hungary as three kind of counterexamples. The UK and Israel, as you well know, have been leading the world in their vaccination programs, and yet they both went into hard lockdowns. The UK in December because of the emergence of the B117 variant, and Israel in January, even though they were at that point already, I think over 40% had received first doses. Similarly, Hungary has had, I think after the United Kingdom, the highest share of population that has been inoculated, and yet they have been hit right now by their deadliest outbreak, and they are living through their worst period in terms of COVID fatalities since the pandemic began a year ago, despite a pretty robust protection from vaccinations. So I guess the best that we can conclude from all of that is that there are a lot of different factors at play. We've got to look to, I'll give you one of the reasons. I know there will be critics out there saying that we should be going into a hard lockdown, but we quite intentionally tied relaxation to hospital capacity, meaning that we're going into this wave with greater capacity than other provinces like Ontario are. So we have to look at a whole range of factors to inform our policy.
Right. Operator, can you please put through our next caller?
Thank you. Jeff Slack, 660 News.
Hi there. Thanks for taking my question. Premier, you had said last week the measures that were currently in place were strong enough. Is this announcement an admission that you were wrong and that we should have brought in stricter measures before the Easter weekend?
No, I still believe that to be the case, that if everybody were to comply with the public health measures that were in place over the past few weeks, we wouldn't be seeing the kind of huge exponential growth that we are right now. As I said, there is growing evidence of, I think, fairly widespread noncompliance, and I'm not calling people out. I'm really not. I'm trying not to be judgmental. I just recognize a lot of that noncompliance is people's just COVID fatigue. They're just tired of it. They let their guard down. And I've always said we're never looking for 100% perfect compliance here. That's not realistic. We just hope people will make an effort broadly to follow the guidelines. Unfortunately, we are continuing to see accelerated growth driven by the variant and concluded that these additional measures were necessary. Part of the, I'll be honest about this, part of the irony is that the sacrifices made by people that follow the rules in a sense, is necessary for the minority of people who don't. And so unfortunately we have to suspend certain kinds of, let's talk about in dining restaurants and bars. We know a significant number of cases of outbreaks associated with people table hopping and not sticking to the rules, not sticking to their family cohort, and going from table to table and going from bar to bar. That is not consistent with the rules. So unfortunately, we've had to take an additional step to pause in dining service. So this is, if there is a significant level of non-compliance, the tools at our disposal are pretty limited. And we are using some of those tools here today. But again, it comes back to this. As I said last week, we could have we could adopt the hard lockdown, the Quebec-style curfews and stay-at-home orders and shut most businesses and shut the schools. But if people didn't comply, it wouldn't make a difference. What matters is people buy into this. We hope that they will.
All right, perfect. Jeff, did you have a follow-up at all?
Yeah, I just had a quick one. We've seen quite a jump in the variant cases today. It was over 600-something. Are you expecting the variant to become the dominant strain this week?
Well, that's, I think, more of a scientific question for Dr. Hinshaw, but we have seen at least a couple of days where it has exceeded 50% of the new daily cases. It's now about 40% of the total active cases. So I think it's fair to say that in the next week or so, it will become the dominant variant of COVID-19 in Alberta. Doctor?
Yes, I think that's accurate.
Perfect. Operator, we have time for about 3 more questions today. So can you please put through the next caller?
Vincent McDermott, Fort McMurray today.
Hi, this is for the Premier. So now that just over a year since the pandemic began, and we're starting the newest chapter of this open-close Groundhog Day nightmare, have you looked back at the past year and seen any failings with how your own government has handled the pandemic, either with preparing our health system from getting overwhelmed or the timeliness of lifting or announcing restrictions?
Sure. Vincent, good question, and one that I often reflect on. I could point to a lot of things I think we didn't get right. I have done so publicly. For example, in the first wave a year ago, we made, I think, a stupid distinction between essential and non-essential businesses. Of course, every business is essential for the people who work there, and that resulted in, effectively, in us suspending most retail small businesses, but allowing most box stores to operate because they sold essential things like pharmaceuticals and food. That was an unfair application, and really the risk associated with retail is not different based on the size of the store or the nature of what it sells. So that was a mistake that we corrected on. Another mistake that we made early on was applying the measures to drug treatment programs, including residential drug recovery programs, the heroin replacement programs, the group meetings like AA and NA. And by suspending all of those things, I think that sadly accelerated the overdose crisis in the spring. Now, we quickly course corrected within 2 or 3 weeks, but those are some of the examples, I think, of where we got it wrong. But when you talk about opening and closing, look, I get it. I said when we started with the path forward that one of the reasons we wanted to be very gradual about this was back in the last week of January. One of the reasons we wanted to be quite gradual about reopenings and tie it to hospital capacity, was because we didn't want to be on this roller coaster of opening and closing. But Vincent, if the alternative is just to do what some other provinces and some other countries have done, which is to have tight restrictions for months and months and months on end, I don't think that's preferable, at least in the past 2 or 3 months. A lot of businesses, including restaurants, were able to make a few bucks and keep people employed with dine-in service. I hope and believe that will help some of them survive this year. So I don't regret opening when it's been prudent to do so. I think that would be preferable to the foolish consistency of a prolonged closure of a lot of businesses. So what we're doing, Vincent, is following the data. And I wish the virus operated in a simple, predictable, straight line, but it doesn't. These variants certainly don't.
Do you have a follow-up at all, Vince?
Sure. So I think everyone on this call, both media and in government, knows some people who pushing conspiracy theories just can't be reasoned with. But how is this government going to be fighting vaccine hesitancy as more people become eligible?
Well, actually, very good question, Vincent. We are concerned that so far the take-up on the vaccines has been a little lower than we initially projected. That does concern us, and so we'll be redoubling our efforts to encourage Albertans to take these safe vaccines. We'll be putting out more information about their safety. Secondly, the reality is that we're polling on this, and we've actually seen a slight increase in the number of people who say they're willing to get the vaccine. So I think there's always been, Vincent, look, let me break this right down. I think there's always a hardcore anti-vax crowd that is, for whatever reason, kind of dogmatically opposed to vaccines in general and this vaccine in particular. And there's probably not a lot of utility in trying to argue with those folks. We can put out the information, but they're going to make up their own minds. Then there is about 2/3 of the population that is pretty keen to get the vaccine. The key is there's a piece in between, about a 15% segment in between, whose attitude has been sort of wait and see. We'll wait and see if this thing is safe, how it goes. And now that we're 5 months into vaccines being used here and around the world, I think that it's increasing the confidence level for that segment of the population. So I think they'll come around, and I'm optimistic that we'll exceed our basically our 75% target at the end of the day. Dr. Hinshaw, do you want to add anything about vaccine hesitancy?
The only thing I'd add is that we know that it's really important for people to hear not just from official sources in government, but to hear from the people that they interact with on a daily basis. So we're working with healthcare providers like pharmacists, family doctors, to make sure that they have access to the latest and most accurate information as they're having conversations with their patients. And we're also working to meet with a whole bunch of different stakeholder groups to make sure that different organizations and different levels of government have access to the most recent information around vaccines so that we can answer their questions directly and help support them as they serve as champions of the importance of protection via vaccines in their communities.
Thanks, Dr. Hinshaw. Operator, can you please put through our next caller?
Camilla DiGiuseppe, CDB Calgary.
Hey there, good afternoon. Thanks for taking my call. My question, we understand that there are about 300,000 doses of vaccine in freezers in Alberta, correct me if I'm wrong, but they are waiting for people's arms to be administered to. But we've all heard of stories of wait lists and walk-ins to control vaccine wastage. What are you telling pharmacies about managing their supplies?
Sure. Well, I'll actually invite Minister Shandro to respond to part of that. The 300,000 is largely because we received 175,000 doses of the AstraZeneca via the federal government last Thursday when they were supposed to come in yesterday. So we received the doses 4 days ahead of when they were scheduled to arrive, and we are now having those sent out to the pharmacies. We'll also be making some of those available through our rapid flow-through clinics, which will be set up in several cities this Friday and in Edmonton and Calgary, we hope next Monday. And in terms of the protocols around pharmacies, I'll invite Minister Shandro to add to that. Pardon me.
Thank you, Premier. And just to reiterate what you had said, Premier, that those 347,000 vaccines that are in inventory right now, they were received in the last 4 days. And if you were to add up all of the vaccines that we've received since we started getting the COVID vaccines, dating back to December, and add them all up, a third of them were received in the last 4 days. So yes, the pharmacies and AHS get those vaccines out the door as quickly as they can, and those vaccines right now in inventory are going to get into the arms of Albertans as quickly as possible. For the direction that's been given to our pharmacies, the ministry has directed the pharmacies to get them out as quickly as possible, and to make sure that there is no wastage. So if there are any appointments that are missed, for them to have the wait list, for them to be able to contact Albertans and get those vaccines in the arms of Albertans as quickly as possible. I hope that answered your question.
Thank you, Minister. Camilla, did you have a follow-up at all?
I do, and this is actually going to go back to the P1 variant that entered Alberta from that traveler who returned from BC. Can we confirm if this person was part of a ski vacation in Whistler?
Dr. Hinshaw.
So this particular individual, to my knowledge, was not in Whistler, but we have had other introductions of P1 variants in people who had been to Whistler. And again, that's something that we're looking at. I want to be really clear that while we notified the public about this particular outbreak, we have seen other P1 cases, and we're following up on those very aggressively, just as we have done with all variants that we've seen. And there is definitely a connection in many of them back to Whistler or to other ski destinations. And so that's something that we are very aggressively following up on. But it really underscores, again, that this variant, like the B117 and other variants, spreads quickly if we let our guard down. So the same thing would apply to these cases as applies to all cases, which is that every day we need to follow the measures to stop spread from happening before we even know that that virus is there.
Thank you, Dr. Hinshaw. Operator, can you please put through our final question of the day?
Thank you. The final question is from Audrey Neveu, Radio Canada.
Hi, and my question is for the Premier. Thank you for taking my question. I just want to hear you in French about something you said about your conscience. Monsieur le Premier ministre, vous avez parlé de ce que votre conscience vous a dit de faire par rapport aux restrictions. Pouvez-vous me le répéter en français, s'il vous plaît?
Oui, pour dire que j'ai dit au Conseil des ministres ce matin que selon ma conscience, il faut agir pour protéger les vies. Évidemment, ce n'est pas possible à prévenir entièrement la perte de vie pendant une grande pandémie comme COVID-19, mais je crois qu'il y a une responsabilité morale pour la société, y compris le gouvernement, de prendre certaines actions nécessaires pour prévenir une grande perte de vie. Aujourd'hui, nous avons surpassé 2000 morts à cause de COVID-19 en Alberta. C'est une tragédie. Heureusement, c'est beaucoup moins élevé que dans d'autres provinces et dans d'autres pays. Mais maintenant, nous faisons face à une vague très grave. Si nous ne prenons pas l'action, il y a une possibilité que ça va surpasser la capacité de notre système de santé, de nos hôpitaux. Et ça mènerait vers un désastre avec potentiellement centaines de morts, centaines de vies. Et je trouve ça inacceptable. Alors pour moi, c'est une réflexion de conscience, entre autres.
Do you have a follow-up at all, Audrey?
Yes, I do, about what some pastors have been saying, not to respect some of the health measures. Donc, Monsieur le Premier ministre, il y a beaucoup de pasteurs, d'autres personnes aussi qui ont appelé carrément à ne pas respecter les mesures de santé publique que votre gouvernement a mis de l'avant. Qu'est-ce que vous leur répondez après avoir eu cette réflexion, justement?
Je dirais qu'au cœur de la foi chrétienne est une croyance dans la sanctité de vie humaine, dans les dignités de vie, particulièrement des vulnérables, et de mettre en péril les vies des vulnérables, je crois, n'est pas cohérent avec cette foi. Toutes les grandes foi du monde mettent une emphase sur la valeur de vie humaine. Et ce que nous demandons des Albertains en suivant les règles de santé publique est de protéger les vies des autres et particulièrement les vulnérables. Et je dirais aux ces pasteurs, s'il vous plaît, considérez ça d'une façon morale et même biblique. Ça veut dire la protection des innocents, qui est un impératif moral dans votre foi.
All right, that wraps up our event today. Thank you so much for joining us.
Thank you, everyone.